Whether you're a new parent learning to navigate with a newborn or how to deal with a toddler having a tantrum, using tips and tricks from taking temperatures to fighting fevers and potty training to training teens about proper hygiene, we've got you covered. So grab your notepad and number 2 pencil because school's in session. Today, we're going to highlight the symptoms, discuss some of the treatments, and answer any questions you may have on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome, everyone, to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Nurse Katie, and today's lesson is learning how to keep your kids healthy and safe, from infant to teen and everything else in between. Let's kick things off with a YouTube question from Bree. Hi, Nurse Katie. Our beautiful baby girl is almost a year old now, and we're trying to figure out the best way to take her temperature. The next time she has a fever, is she old enough for us to put it under her tongue? Bree, I am so glad you asked me this question. Thanks for reaching out. The well-being of your child is important, and understanding how to take their temperature can be a valuable skill and provide valuable insights into their health. I understand that taking your child's temperature can be confusing at times. There are different methods for taking your child's temperature, and the right method depends on your child's age. It's important to ensure the measurement is accurate. For children under 2 years of age, taking a rectal temperature provides the most precise reading, although it may not be the most comfortable for the child. If you are not comfortable taking a rectal temperature, you can take the child's axillary temperature, which is under the armpit. While taking a temperature under the armpit is less accurate, it can still indicate whether your child has a fever. Between ages 2 to 5 years of age, you can take the child's temperature by route of rectal, armpit, or tympanic in the ear. If you choose to take the child's temperature via the ear, it is important to remember to gently pull back and up on the ear to get the correct position and the most accurate reading. For children older than 5 years old, you can now take their temperature orally, as long as they can follow directions to hold the thermometer under their tongue. If not, continue to take it via the armpit or the ear. This chart will help you decide which method to use. So to answer your question, Bree, it is not time to take your child's temperature by mouth. While we are on the subject, let's go through some guidelines for fevers for all ages. If your child is younger than 3 months old and has a rectal temperature of 100.4 degrees Fahrenheit or higher, it's best to call the doctor. If you can't reach your doctor, it is advisable to go to the emergency department as soon as possible. If your child has a fever of 105 degrees Fahrenheit or higher, regardless of the age, including teens, it's important to seek medical attention immediately. If you can't reach your doctor, it's best to go to the emergency department. If your infant, usually less than about 1 year old, has a fever of 102 degrees Fahrenheit for more than 2 days without a clear reason, it's important to consult your pediatrician. And if your child has a fever, you can give Tylenol, also known as acetaminophen. If they're older than 2, the dose will be listed on the label according to their weight. If they're younger than 2, please ask your doctor how to give it. Another option is Motrin or ibuprofen. However, you can only give this if the child is at least 6 months old. Again, the dose will be listed on the label according to their weight. In addition to medications, there are other things you can do to help your child feel better if they have a fever. You can put a cool compress on their head and keep the room at a moderate temperature. Give them a lukewarm bath, not too hot and not too cold. Dress your child in 1 layer of light clothing and make sure they drink plenty of fluids. You can also give them popsicle or cold fluids, and that will help bring their temperature down as well. All right, our next question is incredibly important and comes to us from Pablo, who reached out to us on our very own website, allhealthtv.com. Pablo asks, "Hi, Nurse Katie. My brother's kid got into the medicine cabinet last week. Thankfully, he couldn't open anything because of the child-proof tops. But it got me thinking, what should I do if my boy swallows something harmful?" Pablo, first off, thanks for reaching out to us with your question. And speaking of questions, this is a really, really good one. Before I answer, let's check out this video from the good old folks at the Cleveland Clinic.
Kids will put just about anything in their mouths, so obvious poisons are typically locked up. But some things may look harmless, but can make a child very sick. Dr. Ellen Rome is a pediatrician at Cleveland Clinic Children's Hospital. She says kids and even some adults can confuse medications with candy.
Lots of pills can look just like candy. The notorious offender is iron pills, which literally look like M&Ms. And kids can swallow a lot. That can cause vomiting, diarrhea, and death.
Baby powder can cause serious breathing problems when inhaled by a child. Also, some houseplants and outdoor flowers or shrubs are poisonous, so kids need to understand why they should only sniff the flowers. Things like mouthwash, facial cleansers, and perfumes are a danger because of the alcohol content.
Accidental poisoning is common, especially among toddlers and anybody aged 1 to 3 years old. Children explore their environment as part of their normal, natural development. They learn about new things from playing with them, trying to open containers, mimicking what they see, siblings or even adults do, and by putting things in their mouth. Swallowing a poisonous substance, spilling it on the skin, spraying or splashing it in the eye, and it can all lead to poisoning. A child may also be poisoned if they are given the wrong medicine or a wrong dose of the medicine. Always make sure to double check the age and dosage of the instructions before giving medicine to children. Young children do not know the difference between what is safe and what is dangerous. It is your responsibility to make your home safe for your children. Do not assume that your child can understand safety messages. Telling a child a product is dangerous is not enough to protect them from poisoning. Most poisoning involving children do happen at home, but they can also occur while visiting friends, family, or even being on vacation. Poison may be swallowed, spilt on the skin, sprayed or splashed in the eye, or even inhaled. Children are often poisoned by substances left unattended and easily accessed in places such as on a bench or a table, in a visitor's bag or somebody's purse, or even in bedside tables. But don't assume that high cupboards provide safe storage, as children learn to climb to get to things. If your child has had a significant poisoning, any symptoms that develop will depend on a number of factors, such as which medicine or chemical is involved and how much the child has been exposed to. Symptoms of poisoning may include nausea, vomiting, drowsiness, falling over, and even sometimes abdominal pain. Do not wait for poisoning symptoms to occur before getting help. The best prevention against poisoning is to make sure that children do not have access to any poisons or medicines. Some safety tips include checking your home to make sure that all poisoning risks have been removed. Ask other people who care for your child, such as grandparents, to do the same. Store all medicines in a locked cabinet. If you carry medicines in your handbag, make sure the bag is kept out of reach of children. Store household chemicals, such as cleaning or gardening products, out of children's reach, preferably locked away. Avoid distractions while administering medicines and follow the dosing instructions on the label. Parents and people who care for your children should establish a checking system with each other to avoid giving double doses of the same medicine to children. Store poisons out of reach and out of sight, including those stored in the refrigerator, particularly if it's brightly colored liquid. Don't underestimate a child's ability to climb and reach things. Check the child-resistant cap is working on medicine and cleaning containers, and make sure the cap is shut properly after use. Avoid taking medicines in front of your children. They may think that you're having something nice and try to copy you. Always keep your dishwasher door locked. Don't leave paintbrushes soaked in paint, that your children could get into. Keep your own and your visitors' handbags out of reach of your children. And never transfer chemicals or cleaning products to another container, especially food or drink containers. Because this is such an important topic, I think we should put up a graphic. If poisoning does occur, number one, gather as much information about the ingested substance as possible. The name, the quantity, and the time of the incident. Number two, call 911 if your child is experiencing chest pain, difficulty breathing, or loss of consciousness. Number three, call the Poison Center at 1-800-222-1222 for expert advice. If there are visible poisoning substances in the mouth, remove them. If the child has inhaled something poisonous, take them outside to get some fresh air. And if poison is on the skin, rinse the skin with water. This next question is a little funky. It's from Courtney on Facebook, who's having some teen issues. Courtney asks, "Hi, Nurse Katie. We love our teenage daughter. We sincerely do. And I don't mean to sound indelicate, but she's been smelling a little funky lately, and her room looks like a war zone. Can you give us some tips on how to encourage her to make personal hygiene more of a priority?" Teenager, messy and funky. I think I know what's going on. But before I answer your question, let's check out this video from our friends at the CDC.
Hey parents, want a tip to help improve your relationship with your teen? Understanding what's happening to them, physically, emotionally, and socially can help. Roughly between the ages of 11 and 17, puberty raises hormone levels and changes the body. Meanwhile, the brain's rational decision-making section is still developing, leaving teens to rely mostly on the emotional section. Socially, teens begin spending more time with friends, start dating, and focusing on interests outside the home. Patience and understanding can help you adapt your parenting to these normal changes in a teen's life. To learn more about adapting to the teen years, visit Essentials for Parenting Teens. www.cdc.gov/parents/essentials.
When it comes to teen hygiene, it's important to have open and understanding discussions with your kids. Here's a rundown. When it comes to showering, most elementary school kids don't shower every day, and they don't need to. But once puberty hits, daily showering becomes essential. It's important to recommend that they use a mild soap and wash all parts of their body, including under their arms, their genital area, and between their toes. Also, it's essential to ensure that their body is thoroughly dry before they get dressed. It's important to discuss the pros and cons of daily hair washing. Some teens may prefer to skip days to prevent their hair from drying out. Others may want to wash their hair daily, especially if they have oily hair, which can both look greasy and aggravate acne. As your children goes through puberty, their sweat glands become more active, and the composition of their sweat changes, leading to a stronger odor. It's important to help them incorporate deodorant or antiperspirant into their daily routine. Many teens may feel self-conscious about sweating, so it's important to offer reassurance and support. Before puberty, your kid might have gotten away with wearing the same shirt or even the same underwear and same socks day after day without even noticing. But after puberty, that won't fly. Get your teen to understand that along with showering, wearing clean clothes each day is an important part of their teen hygiene. Point out that cotton clothes may also absorb sweat better than other materials. As your child enters their preteen years, it's important to encourage them to establish a skincare routine, encouraging them to wash their face twice a day. Even if there's no acne, it can become a very helpful habit. It's crucial to remind them to be gentle while washing, especially if their skin tends to be oily. Scrubbing too hard can potentially cause irritation and discomfort. Taking care of their oral hygiene is really important, especially for teens. It's crucial to make sure they brush and floss regularly, especially if they enjoy coffee, sugary drinks, or even sports drinks. These can all contribute to tooth decay and bed breath. So it's important to stay on top of their oral care routine. Children should brush and floss their teeth twice a day, in the morning and usually before they go to sleep. They should brush with a pea-sized amount of children's toothpaste that contains fluoride. You'll need to help your child brush their teeth until they're about 7 years old. All right, in case you missed it the first time, here's another opportunity to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, our next question comes from our Instagram page. Monique's question is, Nurse Katie, I heard from another mother in our Mommy and Me group that when infants get a fever, they can quickly become dehydrated. I never thought about that. What are some of the signs to keep an eye out for? And what's the best way to rehydrate your child? Monique, that is a very relevant question. Thanks for reaching out. It's important to remember the signs and symptoms of dehydration in an infant or a young child, such as dry mouth, dry tongue, no tears when they cry, no wet diapers for up to 8 hours, sunken eyes and cheeks, a sunken soft spot, which is in the back of their head, and that's usually for children under 1 year of age. And sometimes it can be very weak or irritable. It can be worrying, especially when dealing with a high fever, diarrhea, or vomiting, as this can worsen dehydration. To prevent dehydration, it's crucial to drink plenty of fluids and eat foods high in water, such as fruits and vegetables. Some examples may be cantaloupe, watermelon, or even celery. If your child has mild dehydration and your doctor says it's okay, you can start treatment at your house. Always remember to start slowly. Give your child small sips of oral rehydration solution as often as possible. For babies, give about 1 to 2 teaspoons, which also is about 5 to 10 milliliters every few minutes. For older children, give about 1 to 2 tablespoons or 15 to 30 milliliters every few minutes. Babies can continue to breastfeed or take formula as long as they're not vomiting repeatedly. Older children also can have electrolyte ice pops. Kids can keep their regular diet unless the doctor recommends a change. They may not want to eat at first, but as long as they are drinking, it's okay if they aren't. You can introduce clear liquids such as Jell-O or even some soup broth. As your child starts to feel better and has a better appetite, you can give less oral rehydration solution and more of their usual food and drink. It's important to advance their diet slowly and start with a softer diet like applesauce or yogurt. Don't give sports drinks, soda, or full-strength juice. They have way too much sugar and can cause some symptoms to even worsen. It's important to dilute these with water. Remember, do not give medicines for diarrhea or vomiting unless your doctor recommends it. If you are attempting these things and your child continues to have symptoms of dehydration or refuses fluids for several hours, please call your pediatrician immediately. Okay, what do we have here? This question is from Diego, who reached out to us on allhealthtv.com. You should really check it out when you get a chance. It's chock full of great information. All right, Diego asks, Nurse Katie, I happened to catch the tail end of a local media show, and they were talking about something called febrile seizures, which I guess has something to do with high fevers in children. I'm a little concerned because my boy, Stevie, has had a high fever for a couple of times in the past few months. What is it, and what should I do if he has a seizure? Diego, thank you so much for this question. A lot of parents are not familiar with febrile seizures. Febrile seizures can be really scary for parents to witness. They often happen when a child has a fever, usually from an infection. Even though these seizures can be frightening, they are usually harmless and short-lived, and don't necessarily mean there's a serious health condition. During a febrile seizure, a child might shake all over, lose consciousness, or become very stiff or twitch in just one area of the body. It's really important to keep the child safe during the seizure and provide comfort afterward. After a febrile seizure, it's crucial to have the child evaluated by a doctor as soon as possible. Your child's health and well-being is your top priority. I can understand that dealing with febrile seizures in children can be very concerning. These seizures usually occur within 24 hours of the onset of a fever and can be the first sign that a child is even ill. It's important to see your child's doctor as soon as possible after your child's first febrile seizure, even if it only lasts a few seconds. If the seizure lasts longer than 5 minutes or is accompanied by certain symptoms, Please call an ambulance to take your child to the emergency room. Seeking medical attention is crucial in these situations. Okay, we have another question from YouTube. And this question is from Trey. This one is a twofer, 2 ailments for the price of 1. Trey asks, "Hi, Nurse Katie. Our sweet little daughter Miranda got hit with a 1-2 punch a couple weeks ago. She came down with both pink eye and an ear infection at the same time. Her pediatrician put her on antibiotics and they both eventually went away. What's the cause of each and how can we prevent it from happening again?" Hi, Trey. Thanks for reaching out. Let's address the pink eye first, but before I share my wisdom with you, let's watch a video from the good folks at the Mayo Clinic.
Conjunctivitis is actually an inflammation of the conjunctiva, which is a thin layer of tissue that kind of covers the white of your eye as well as the underside of the lid.
That can lead to inflammation of the blood vessels, which tends to lead to redness. Most cases are caused by a virus.
The virus that causes pink eye is essentially the same virus that's causing your common cold.
Common symptoms include redness in one or both eyes, itchiness or grittiness in the eyes, and drainage. Treating pink eye no longer includes the use of antibiotics.
Viruses, as we know, don't respond to antibiotics.
Use a cool compress on the eye and consider using artificial tears. It also means you don't have to keep your child home from school.
You would send your child to school if they had a runny, stuffy nose, as long as they were able to participate in normal school activities. Pink eye or viral conjunctivitis is no different.
You can also manage and prevent the spread of the virus with good hand hygiene. Check with your healthcare provider if you have concerns. For the Mayo Clinic News Network, I'm Ian Roth.
So pink eye, also known as conjunctivitis, is an irritation or infection of the conjunctiva, which is the membrane that lines the inside of the eyelid and the whites of the eye. Symptoms of pink eye can vary depending on the cause of the irritation or infection, which may include pink or red discoloration, kind of a gritty feeling in one or both eyes, itching, irritation, or a burning sensation. You can have clear, thin drainage of liquid, stringy and or thick white or green discharge from the eyes. Sometimes your eyelids are matted together in the morning. There could be swelling of the eyelids or even blurred vision. Pink eye has several causes. Sometimes a bacteria, which can be transferred to one or both eyes through physical contact or poor hygiene, or touching the eyes when you have unclean hands, or use of contaminated makeup or face lotions. Viral pink eye can be caused by viruses associated with a common cold or an upper respiratory infection. Chemicals can cause it, and also allergies or sensitivities. Pink eye is usually diagnosed based on a history and a comprehensive examination of the eye. Testing of the drainage or the discharge is usually not required. Treatment is determined by the cause of the pink eye and the overall condition of the eye. It is important to know that pink eye can be very contagious. It is caused by a virus. The risk of spread is higher when the drainage is coming from the eye. The virus can survive on surfaces for up to 2 weeks. So to help prevent the spread of infection, avoid touching your eyes with your hands. Wash your hands thoroughly and frequently. If you do not have access to a sink, use hand sanitizer. Change pillowcases often and do not share eye makeup or personal eye care products with anybody else. And follow your eye doctor's instructions about proper contact lens care. Okay, I'm all done with pink eye. Time to check the ears. I understand that dealing with ear pain in children can be very concerning. There are several potential causes for ear pain, such as an ear infection, swimmer's ear, or pressure from a cold or sinus infection, or teeth pain that's radiating to the ear. It can be hard to distinguish between these causes without an in-office examination by your pediatrician. If your child's ear pain is accompanied by a high fever, affects both ears, or if your child shows other symptoms of illness, your pediatrician may recommend an antibiotic as best course of treatment. It's important to note many true ear infections are caused by viruses and may not require antibiotics. If your pediatrician suspects that your child's ear infection may be viral in nature, they will discuss the best ways to help relieve your child's ear pain until the virus runs its course. It's always best to seek professional medical advice and guidance when it comes to your child's health. The symptoms of an ear infection may be hard to detect. A child who constantly tugs or pulls at their ear may simply be exploring or show self-soothing, but other symptoms can include more crying than usual, especially when they lay down, trouble sleeping or hearing, I know my son, whenever he gets an ear infection, he always says that he can't hear me, and I know right away to make a doctor's appointment about that. They can also have fever or headache or fluid coming out of the ears. All right, well, I hope that information regarding ear pain helps. So let's do a little recap of what we learned today. We went over febrile seizures and spoke about that. One of the very most important things was talking about poisoning and making sure that you keep medications away from children and even some chemicals. We talked about teenagers going through puberty and proper hygiene of those teenagers. We also talked about fevers and when to be able to take a temperature in a child. Remember, you can do it usually around younger than 2 years. You want to do rectal, but you can also do the armpit. All right, well, I think that's it for today. We don't have time for any questions, but thank you for listening, and we'll see you next time on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.